where I live, like Montreal said, he was growing up in Southside Orville. I live in that area, but not technically in there. But I'm aware that I used to hang out down there when I was younger. I know all the stuff that goes on, and I really can't stand it. I need, I want people to be able to get the support they need from the people that know how to give it, not people like John was saying, like CPS coming to your house. I've seen that from my friends, very good friends. They've been taken away from their homes because they weren't getting the right help, and CPS just came in and like basically took them out, and I never really got to see them again.
Were you worried that was going to happen?
For me, no. My household is pretty well, but like I wasn't really where my mom. I live with my mom and my grandma. My dad kind of basically abandoned me before I was 6, so I've kind of been living with them most of my life, and just our basically we get by. We get by. We're not really dirt poor, but we're not really enough to blow $100 easy or whatnot. And I learned a lot of just normal standards of going through life from just being in that sort of position. And I've seen it happen to everyone. I haven't experienced most of the things I know about, but it's just that's usually what my authority is. I can deal with someone. I can relate with someone who's doing drugs. I know a way I can talk to people out of it. I've had friends that have been involved with drugs and gang violence and stuff, and I've been able to, at least get through it to them to a sense, to get them have enough level-headedness to stay away from the most, hazardous situations. Excellent.
Well, congratulations on turning your life around. I bet your family's pretty happy.
Yeah, my mom and my grandma always make, thoughts, comments to everyone, everyone's really proud of me, even the counselors and stuff, and I feel a great deal of accomplishment just being able to, even right now, being able to speak. I wouldn't be able to do that
a couple of years
ago. I wouldn't been able to do none of this, and in a couple of months, if I'm correct, is that we're going to Anaheim to do a presentation about CCOC. And I'm one of the youth going, and I'm like, I've never even been on a plane or let alone, spoke in front of that big of a crowd. And it's just going to be a really good experience, and I know I can do it. I'm going to give my best shot at it.
Excellent. You're listening to I-5 Live, and the phone number is 1-800-234-5246 if you have any questions or comments. I worry a little bit about, the funding for behavioral health and, for all county and city agencies in terms of the state budget, federal budget, all those issues. How do you keep this program going with all the difficulties in funding?
The program was started with some funding from SAMHSA, which Substance Abuse Mental Health Agency. It's a federal agency that got us started, got counselors hired. As the years go, it'll be this year we are matching with some of the sustainability comes from Medi-Cal billing, and we will be looking to find other resources as we go on for youth activities and for extra stuff. But a lot of it is sustainable through billing.
What do you think, you other counselors, what do you think, we'll start with Montreal Jamari, and what do you think about the possibility of, the importance of continuing this on even if there wasn't enough funding? Are you concerned?
I am concerned because I see the difference that it makes in the communities that we serve. I mean, we just heard from youth here that, his life has been changed around, and some of the things that he's experienced, at a young age. And so we don't need to take away something that works, and connecting circles of care is something that works. So yeah, I do have my fears about sustainability and how that's going to maintain over the years, but hopefully the people out there that are listening would talk to their congressmen, or talk to their, whoever it is, to want to see their youth helped. It's important for them to have a voice, and this is the voice of the community, of those who've been asking for help. It's here now. It's happening right now, and so we need them to speak out a little bit more.
Yeah, mental health funding is very, very important. That's a good point, Montreal. It's right up there with education and all the other really important programs.
Yeah, I fear that the money will go away. And a lot of the things that really make our program unique are the opportunities to take youth on outings, opportunities, to purchase things for meetings, things, and these things are kind of essential for the program. It's difficult to run a youth activity when you have no money to run an activity, and when you are a program that thrives on, or that has key principles like being culturally aware, you need to be able to invest in different types of events that will show that you're culturally aware and also show that you're engaged in the community. We're looking at sustainability through, primarily Medi-Cal billing, and I don't know how much that will be able to sustain in the end, but we had a multi-million-dollar, federal grant, which is going to go away, and and how we can't replace all of those dollars through by any way.
And we'll need to build partnerships with community organizations, business organizations, Rotary, and build stronger alliances with other organizations as well.
Well, what kind of resources, does the African American community have in Oroville to help possibly fund a program like this? Are there any resources?
That's a good question. I think we primarily when they first started, it was and even now we partnered with the different churches in the community, because we found that that's where a lot of the African American population would go to if they had different types of diagnosis. And so they trusted the pastors. And so what Connecting Circles of Care did was they went to the pastors and to try, and by the way, it is faith-based also, part of this program. That's a key component of it. So they went to the pastors to try to see what they can do and partner with them. So as far as I know, I think it's the churches that would be supportive in a way. I don't know how much of that would be financial, but I know that is a key component as far as the African American community is concerned.
How about the Hmong community? Do you have some funding if this program were to go away? Is there some funding in your community that might help keep this program running?
In the Hmong community, we have very small agencies that works towards the Hmong population. We do have agencies, but again, they're small, and I don't see how they would be able to, to serve all these youth and all the Hmong people in Butte County. It's just, it's a hard thing.
How many kids are in your program?
We have a caseload of 19.
From the Hmong community?
Yeah. Mm-hmm. And I just want to point out that one of the strengths and one of the great things about the program is its cultural competency. Mm-hmm. I'm a social work student. I go to school, and I hear a lot in the literature, and I hear a lot about being culturally competent in services, and I can truly say that this is one of the agencies that truly strives to provide culturally competent services, and I think that is one of the great aspects that makes this program work so well and so successful, is the utilization of culturally competent services.
Our phone number is 1-800-234-5246. We have Nick on the line from Chico. Nick, do you have a question or a comment?
Yes, a question and a comment. Comment first is it sounds like a really incredibly great program. I congratulate you all in behavioral health in general. It sounds like you're focused on subgroups within our community, the Hmong, Afro-American, Rural Mountain, and I understand that. I think I get that. But I'm wondering about the term of the title, Connecting Circles of Care. Is there any overlap among the various groups? Is it on a staff level, a client level, or both? Or